The alarming rate of people taking medication from a hospital. Whenever you go to the hospital, they will prescribe medication for you. CDC has already said that there is an alarming rate of patients receiving unprescribed the drugs that their body don't need. On the process of them receiving medications that their body don't need for that particular diseases that they are receiving, they end up being in their kidney, or their organs will be shut down and it will be toxic to their body. The medication becomes a toxin. And other part is that the alarming rate of people receiving drugs, which is medication, and they are liable to be dependent for their drugs and their health. So the alarming rate of the medication of people receiving high dosage of medication from the hospital, from the statistics that the CDC has published, made it to, for us to understand that we are into the era of having people high doses of drugs to people, so dispensing medication to them, which is the nurses and the doctors have to improve on. Now, on the process of um, focusing on the or solving the chronic dispensing of drugs in the society, which is the medication. I'm not talking about street drugs. I'm talking about the medication. That's the reason why I'm using medication. So, is the solution number one is to make sure that the person or the patient that they will prescribe the drugs or dispense the drug will receive the exact medication they need at exact time and an exact dose with immediate effect, not to be giving them constantly or making them to be dependent of the drugs. And when our body is consuming those drugs, which is toxins to the body, because in our body we need a certain amount of drugs that will secure our body or from the harmful diseases. So when our body is intaking and be taking the medication, the drugs, it will accumulate, and also it will make our kidney to shut down, or the liver to shut down. So in the process of the solutions of not to fall into that victim, those people that fall into the victim will fall into, which is going to dialysis, and their kidneys or their liver will shut down. They will try to look for a kidney or liver transplant, which we don't need to make them to have, and when they don't need to be involved to be in that situation. And the process of solving it is combating this whole thing is dispensing exact drugs in a little time, use a smile and major remedy. Number two is to make sure that they the exact thing that they needed in the life, and also living in a society whereby they have ordinary men out there in the society on the street have access to ordinary drugs that antibiotics that makes them not to be makes the diseases to be resistant to the kind of diseases that they contracted. So if you giving antibiotic to a body, and it will make the disease not to go. If the person missed the medication time, the antibiotic will not work exact as the doctor has prescribed it. So these are the things that we need to talk about, and these are the things that we need to work in the society to make sure that all our patients have taking the drugs at exact time and exact period, and also stop the medication exactly at the same time that the doctor say you should stop taking the medication, because all medications have exact time to stop taking it once the disease has gone. Talking about the medications about mentality, like mental problems and depressions and things, we need to walk into that for our patients not to dependent on that. That is reason why our patients are dependent on that, and we need to walk into situation whereby we have to make sure the patients that are taking, they have already taken the medication for depression or anything that they are taking previously, not to go back and start taking it more than they expected, because they will be dependent on drugs, and they will, as they are dependent on drugs, they will never ever escape it, or try to run away from it, because they will depend more on it. So these are the things that we need to talk about in the society. We have to work towards it and make sure that our society is being safe from drugs. Thank you very much. That's my message today. Thank you. Bye bye.